All right, we're live now. Namaste, everyone. Welcome to Hindi University. Really excited to have all of you this Sunday. As you know, my name is Ashutosh, and we meet every Sunday, 8 a.m. US Pacific time, which is time on the west coast of the US to learn about the Hindi language. For those of you who are new to Hindi University, you can learn more about us by going to our YouTube channel, which is youtube.com/Hindi University. You can also find out the details about all the classes and the practice sessions that we have on our website, hindiuniversity.org. Okay, and if you're just happen to watch this video for the first time, this is a little bit of information about HU and how you can interact with us. And for Sunday classes, there's not much requirement. As long as you want to commit some time to learn and you're sincere, you can join this Zoom link and start engaging with other practitioners as well as like join the Sunday classes regularly. If you missed any of the previous sessions, you can catch up on the YouTube videos. And then now Marwaji is making shorts as well. So you don't have to watch the entire class. You can just, watch a 2-3 minute segment to catch up on the previous concepts as well. Okay. I use this WhatsApp link, and this is primarily to enroll new students. Once you are, familiar with HU, we will onboard you to the private, Discord and the WhatsApp group. So that way, but this is sort of a public one, and we use it to find the genuine learners. Okay. As you know, this year, we are taking a slightly different approach. We are focusing a lot more on the conversations. So while we are learning grammar, we are also trying to apply grammar in different scenarios. In the past few classes, we've tried it and it's working quite well. My only encouragement to all of you is keep trying. Like, in 50 weeks, you would have tried 50 different scenarios. And if you just push yourself each week a little bit more, there will be a compounding effect of it. So even if it means you are making slight mistake, it's okay. Don't make that mistake again next week, right? If you made 1 or 2 sentences, try 3 next time. Okay. If you made affirmative sentences where you are saying something, try asking question in the next one or making interrogative sentences. So this is a chance, take risk, and then trust me, anytime you say something, it's a sense of relief, right? It's a lot of confidence that you build, right? So, and this is the that environment where you can take a lot of risk, right? So there's no that's definitely good. And a little bit more logistics. I want to share some of the practice group that we have and some of the announcements. So Peter G, and this is shared by our HU folks who've been with us for many years, right? So Peter G is really starting Pingu Learns Hindi again, and you can see it's going to be February 17th. So if you're brand new, don't have any prior sort of background of Devanagari or Hindi learning, Peter G will be starting Pingu Learns Hindi again, and this is complete beginner's book. Okay, and you can see it's going to be Tuesdays and Thursdays at 1:30 p.m. EST. So you will have to translate the time into your local time, and you can join Peter G. And if you have any questions, definitely post it in the Zoom chat, and then we'll discuss that. Similarly, Sharon Ji is starting elementary Hindi book, right? And she'll be going over Professor Richard DeLacy's book. And some knowledge of Devanagari is strongly recommended for this particular practice session. And the classes or the practice session will be on Thursdays starting March 19th. It's a tentative date, so if there's any changes, we can definitely discuss that, right? But it will be hosted by Sharon Ji. And the beauty of it is like, if you want to join the elementary Hindi, as soon as you finish Pingu Learns Hindi, you'll be very well prepared for this one, elementary Hindi. So if time permits, I definitely recommend you join the both the sessions. It'll be a very good journey and an amazing host. Right? Now we have Austin G. Austin G, you want to share a little bit about Sunil Bhatt video practice session?
Namaste, yes. So we base our practice session on these grammar videos by Professor Sunil Bhatt, and the accompanying textbook, which is the Living Language Hindi, a complete course for beginners. So basically what we end up doing is we review the videos and then do a bunch of practices on the grammar topics, similar to the Sunday class. And we'll get a little bit of like listening practice and reading practice as well, but it's mostly focused on instilling those grammar concepts. So our time is 8 p.m. Tuesdays, EST, US time. That works out to be 1 a.m. Wednesday UTC time. So you can translate that to your own time zone. We tried to make it so that Devanagari script is not required, but a lot of times it's quite useful to be able to read it. And we're currently about 2/3 of the way through the book in the video series right now. We'll probably be finishing it up and restarting in April or May.
Nice. Are you in some place called Austin?
Yep, I'm in my car.
Oh, I see. I see. Oh, thank you so much. Thank you so much. Okay, and so as I mentioned, it's a great way for you to get engaged with other practitioners who've been practicing Hindi for a while, and then learn from that, right? So it's another immersion experience for all of you. Okay, so with all those logistical details, we'll jump right into where we ended last week's class, right? So in the last week. I told you guys that we will discuss the scenario of visiting a doctor. Okay. You visit a doctor when you want to check your wellness or when you have a pain or aches, right? Different topics that you can talk about. Like we have a doctors also in the current class, as you can some of you may be aware of it, right? I mean, so how do you talk about sickness or your well-being to a doctor? Okay. Um, so what I'll do is I'll definitely throughout the class I'll ask you guys to talk about how you or what you prepared. Okay, start with very basic sentences and then we'll build on top of it. Okay, along with that, even if you didn't get a chance to prepare, that's okay. We'll discuss the different ways you can talk about wellness, and I'll give you some templates also that we can use. Okay, so with that in mind, I'll jump right into the class, and then the one way to discuss, and one of the easiest one that that you can use in to talk about your wellness is you talk about your wellness is basically you mention the parts of the body to the doctor, and you say that that pain is located here. Okay. So there will be a verb that will be along you use along with that. Okay. Which is basically, what is the verb here? Anyone would like to mention what is the pain, or to feel hurt or to feel pain?
Dart.
Yeah, very good, right? So the verb here is dard. Okay, dard. Okay, so generally, when you want to say that there's a pain, there is a pain, you will say dard hai, dard hai. Okay, now you can talk about, when you say dard hai, and then working backwards, you want to say may. The immediate question would be for example, if you were to just randomly say dard hai, the next question to you would be from a person who would be kahan. Dard kahan hai? Kahan is where? And you would want to locate the position, and you will say in your ear or in your head, okay, in stomach. Okay, so naturally, this is your post position may. Okay, and then you can say ear or you can say kaan. कान में दर्द है. Okay, कान में दर्द है. There is a pain is located in the ear. Okay, कान में दर्द है. Or you can say पैर, which is your leg. Okay, पैर में दर्द है. Pain is located in your leg. Okay, or you can say सिर में दर्द है. सिर, or I write it as sir but read it as सिर. सिर में दर्द है. Or sometimes sir dard itself is considered like a word, so you skip, the may, and you say sir dard hai. That means like, the headache is there. So far, we've not used any pronouns, but I want to break it down so all of you can follow along. Okay. if I were to just simply extrapolate this pattern and I want to just replace the parts of the body, what else I can try? Okay. So Joyce, I know I'll put you on spot, but which other parts of body you can use to mention that the pain is there?
Garden में दर्द है.
Okay, very good. Gardan mein dard hai. The pain is in the neck.
Neck.
Beautiful.
Yeah.
Yeah, very, very good. Right? Let's try. Josh, what would you try?
Burina.
Huh?
पेट में दर्द है.
There you go. Pet mein dard hai. What does it mean?
Stomach pain.
Stomach pain. Very good. Okay. Fernanda ji,
पैर में दर्द है.
पैर में दर्द hai. Beautiful. Okay. Leena ji,
गला में दर्द है.
very good. What is gala?
Gala is throat, I think.
Yeah. Very good. Gale mein dard. So, important, right? So you mentioned gala. When you put, very good, right? So when you put post position after gala, something interesting happening in Hindi. Gala becomes,
Gully.
yeah, yeah, beautiful, right? So just like ladka, after ladka you put a post position. It becomes, ladke ke paas or ladke ne, okay? Or ladke se laptop lo. So just like that, you know, it's interesting because the post position of pair is pair, kaan is kaan, sir is sir, but the gala it's ending with the ah sound, and the moment you put post position after that, it becomes gale mein dard hai. Okay, let's see, and then we'll take some more where you have the post position, so you can see how it works, right? The plural of that is, let's say, definitely oblique. So let's say you have pain in your hands, both hands. Okay, Kavita ji, how will you say that?
Heart.
Yeah, heart is one hand and plural is also heart.
हाथ में दर्द है.
Beautiful. If you want to say both hands,
दोनों हाथ में दर्द है.
yeah, very good. So you can say dono haath mein dard hai. Plural, when you have plural, if you have a ladka, plural is ladke. When you put me and me here, ladka becomes Kavita ji. Very good. And ladke becomes
लड़के. लड़के.
ladkon.
Oh yeah, लड़कों plural. Sorry.
Yeah.
Yes,
Yeah.
लड़कों.
No. Very good, right? So then haath becomes
हाथों.
beautiful. Haathon.
हाथों.
Yeah.
Oh.
Yeah. Absolutely. Yeah. So then you will say
हाथों में दर्द है.
beautiful. Haathon mein dard hai. There you go. Okay. Haathon mein dard hai. Okay. Michael ji from Germany, what else would you try? Simple sentences right now.
बाएं कोहनी में दर्द है.
Yeah. Very good, right? So what is daya and what is baya?
दायां is right and बायां is left.
Daya is right and baya it's left. Right? So I'm going to write it down for everyone. So you have a da with a, daya, and you have a ba, ya. There's a nasalized sound. Daya is right, and baya is left. Okay. So you said.
So then it would be बाई कोहनी
Mm-hmm.
में.
Very good. So why bayi koni mein?
Because कोहनी is feminine.
Very good, right? So because bayi, he mentioned baya. Baya is again inflected, right? So it can be baya, bayi, bayi, right? The ending can change. How? Based on what's following that, and because koni is what is koni?
Elbow.
Elbow, right? So koni is your elbow, right? So that's why it's feminine. So he said, बाईं कोनी में दर्द है. Hopefully everyone is following so far. This is your warm up. Now you want to be specific. So far we've not used the pronoun here. Okay. And we'll end up using in the first one, you will end up using possessive pronoun. Like, if I want to say my head, mera sir. Okay. I want to say my hand, mera haath. Okay. And if I want to say my elbow, meri koni. And you see, I use meri because koni or elbow is feminine, right? So we'll switch there and make it just like one level above, up. Okay. So you have mera, meri, and mere. And then you have parts of body you can use from here, or you can use, anything you want here. Okay. So a funny story, if you go to Pingu and Hindi, I have something similar, but I didn't want to draw the image again, right? And so I just told AI to put clothes on this boy. So it just dressed it up nicely, and I was like, okay, this is cool. It didn't change anything. Everything remains as is. And I was like, okay, there you go. We can use it. So, right. Michael D from Pittsburgh.
Let's see. Mericciati.
Very good. Very good. Say it, finish it. Meri Chati would be Meri.
Mericciati.
Huh?
Mericciati. Finish it. Mericciati Dardhe.
Okay. And postposition would be
Mericciati me Dardhe.
beautiful. Meri Chati mein dard hai. And what does it mean?
My chest hurts.
Yeah, my chest hurts. Beautiful. Okay. Very good sentence. Let's see. KTG.
I'm going to choose Gutana because I think it changes.
Yeah.
So it'd be the second bit would be Gutane me garate. But would
Very
it be
good.
mere Gutane
Yes.
me
Yes.
garate?
Yes.
Oh, okay.
So I will. Yeah. So it's a good one. I'm going to write it down because everyone can follow it. So she said, first one is like, what is Gutna?
It's knee.
Knee. Okay. Gutna is knee. When you put me after that, it changes to oblique and it becomes
Gutne.
घुटने में, right? घुटने में दर्द है. Now you want to say my knee would be just my knee.
Well, without the rest of it, it would be mera gutna.
Yes. So you will say mera घुटना. Okay. If you say in my knee, it would be, you will put me next to it.
Mere gutne me.
Yeah, very good, right? So you already mentioned mere, you already mentioned घुटने में. The interesting thing is, even this will change to oblique. So it becomes mere घुटने में. Okay, I hope everyone following it, right? Joyce, did you follow it? Yeah, very good, right? So it becomes mera becomes mere, घुटना becomes घुटने, and me, mere घुटने में, right? So as she mentioned, very swiftly, easily, Dr. Saab, which is sir, mere घुटने में दर्द है. Okay, it's still pain is located here or it hurts. If it is actively happening, we'll talk about how to use present continuous tense. Okay, Bill, you want to give it a try?
Mere sir me dard hai.
Beautiful. Mere sir mein dard hai.
I had one question, Ashutosh ji.
Yes.
In English, tooth pain is a toothache. Is there a difference like that in Hindi?
Toothache. So you can, in a simple way, you can say दांत में दर्द है, right? In a very simple way. So मेरे दांत में दर्द है. You can say that.
Dot is tooth?
दांत is tooth, yes.
Ah.
Right? If you're talking about मेरे दांतों में दर्द है, right? So दांत is one. If you want to say plural, if more than once, it's दांतों में. Just like हाथों में, it becomes दांतों में.
So there's no special thing for toothache, like when people put a wrap around their head and it's like I have a toothache. No?
And then they explain it to me. Maybe I'm not following it. So when you say toothache, describe it more.
Well, and you have a toothache and the side of your cheek swells up and stuff, and people wrap things around, and it's a very special kind of pain. And I thought maybe in India they would have a particular
You're talking
thing.
about swelling.
Swelling and pain, yeah, I don't know.
Okay, so there is a word for swelling for sure, which is sujan. We'll talk about that. If there is a swelling here, you can say मेरे दांत में सूजन है. Sujan is like a swelling. You can use that pretty much across the board. Wherever you have a swelling, you can use here there is a swelling. Okay. But maybe I'll read up a little bit more on it because I'm talking about general, just like sir dard, I'm talking about daant ka dard, right? I mean, so
Acha, dhanyavad.
yeah. People do use generic words, pareshani or pida, but we'll come back to that one. Okay. Anyone else would like to try before we jump on to the next one? Mitaji, let's try one more.
मेरा दिल में दर्द है. Says
One more time.
Says heart. मेरा दिल में दर्द है.
Okay, very good. Okay. Mitaji from LA. Mita Weiss.
I've got some sentences that I want to do. Can I do those instead?
Yes, we will do the phrases also we will do, but maybe we will come back to the phrases right after this one in shortly. So if you want to
Wait,
yeah.
I can wait if you want.
Yeah. Let me see. Okay, and Mayaji, you want to make one?
मेरे उंगली
Yes, मेरी उंगली में.
My finger hurts.
Yeah, so the word pain, the verb would be मेरी उंगली में दर्द है. Beautiful. मेरी उंगली पे दर्द है. Beautiful. Awesome. Right. So what we'll do is, so this is one way of explaining the pain, and I'll take a short pause here, and then now we'll switch to the phrases, like the conversation. Okay, and we'll jump to after that we'll take some examples of what people prepared, and then we'll jump to other ways of explaining pain and how it works in Hindi. This is the easiest one where you can say the pain is located here. Okay, so I'm going to ask some of you who prepared. Based on the exercise I shared. So, Michael G from Pennsylvania, did you get a chance to prepare maybe?
Save me for later because most of mine have ho rahi hai or ho raha hai, and we haven't talked about that yet.
Yes. Okay. It's okay though, actually, if you want to go for it because it will make more sense. So if they hear it right now, at least hopefully everyone can follow the pattern that something is there, and then when I cover it, maybe it will make more sense.
Okay, but I need a doctor. Who's going to be the doctor with me?
Okay, other Michael, your alter ego here. So Michael G from Germany, I think you can handle it, right? So you are the doctor.
Okay, namaste, doctor.
नमस्ते जी. आइए बैठिए. आप आज यहाँ क्या शिकायत लेकर आए हैं?
मेरे पेट में दर्द रहा है.
पेट में. mm, कितने शुरू हुआ है? Like when did it start?
आज सुबह से, लेकिन दर्द और भी बढ़ते जा रहा है।
Mm. Not a doctor, so I don't know exactly what.
Just say or bolo. Keep telling, and it's okay.
Mm,
What should I do for it?
um,
क्या मैं मरने वाला हूँ?
कुछ दर्द का गोली और दर्द की गोली ले सकता हूँ ले सकता है।
हम्म, कितने बारे दिन से कितने बारे?
Like आज से, लेकिन इतने इतने दिन अब दर्द हो गया और हो रहा है, तो हाँ, ले सकता है।
जी हाँ, धन्यवाद डॉक्टर।
Very good, very good. This is a very interesting scenario. Okay, so I know because you guys were just put on spot. Maybe if we didn't pair up before, just say your sentences, okay? And you can, if you want, you can say the doctor's part yourself also, if it makes easier, if you think it's going to help you make the flow better, okay? Or if you prefer, you can say it in Hindi, and for the benefit of everyone, you can say it English after that as well, like the translation. Just like I know it's going to be a thing, but it'll be easier for everyone. So, but thank you so much, Michael ji. Did you have anything else which was not dependent on the doctor?
No, let other people talk.
Okay, okay, wonderful. JD ji.
The video, huh? मेरे
Yeah,
उंगली
yeah,
मेरे
JD ji.
उंगली में मेरे उंगली में दर्द थे।
Oh, अच्छा. और
मेरे पेट में दर्द है।
अच्छा, पेट में भी दर्द है। और
मेरा बाल पेट दर्द है।
अच्छा, very good. Okay, so this is good. Did you have anything else, JD ji? Like, or
No.
just wonderful. Okay, good, good, good. Let's say, who else? Josh?
Yeah. Okay. Here we go. I have a couple of sentences here. Should I just do doctor and patient?
Yeah, do both. It's okay.
Okay. Okay. And then I'm not sure on how accurate these are, but doctor, आपका संकट क्या है? Like, what's your problem? मुझे गले में दर्द हो रहा है. मुझे गले में दर्द हो रहा है जब मैं निगा रहा है. My throat hurts. My throat hurts when I swallow. The doctor, आप कितने से मैं बीमार था? Which how long you've been sick? मेरे गला 4-5 दिन दर्द में हो रहा है. I'm not sure. मुझे बहुत खांसी आ रही है. I'm coughing a lot, or a lot, yeah. And then the doctor, क्या आपको allergies है? Do you have any allergies? नहीं. मैं herbal chai पहला लिया, लेकिन मैं अभी medicine चाहिए. I tried herbal tea, now I want medicine. And then the doctor goes, हर दिन 2 गोलियां खाना के साथ लीजिए.
Very good. And what does it mean, har din?
Take 2 pills every day with food.
Very good, very good. Awesome. So this is good. There was something, but we will work on it. But great work there. Okay. Yes, Mitaji, LA.
Okay, so namaste, Dr. Suni. Namaste, Mita. I'll say the English first. How can I help you today? Aaj main aapki kaise madad ka sakta hoon? My knee is getting better. Mera gutna theek ho raha hai, but sometimes it is hurting. Lekin kabhi kabhi yaha dard ho raha hai. Any suggestions? Koi sujhav? I don't know if that's the correct word, but ye cheez hai. You can wear a knee bandage up gutne ki pati ka istemal kar sakte hain. You can use some of this cream. Up is cream ka bhi istemal kar sakte hain. You can have a good diet. I don't know if this diet word is correct. Up acha ahar le sakte hain. You can walk every day. Up har din chal sakte hain. You can use pain medicine. Up dard ki davar ka istemal kar sakte hain. Yes, I walk every day. Main har din chalti hoon. Perhaps I will use the cream and bandage. Shayad main cream or a bandage ka istemal karungi. Pain relief nahi. Shabash Mita. Koi baat nahi. Main aapse ek mahine mein milunga. No problem. See you in 1 month.
Very good. Amazing. Okay. I like how you use the pattern sakna. Like आप कर सकते हैं, आप खाना खा सकते, अच्छा खाना खा सकते हैं, आप चल सकते हैं. So great job. Yeah. Marwa ji.
ये डॉक्टर ये पेट चाहिए क्या तकलीफ आपको मुझे अलग अलग लक्षण which is symptoms महसूस हो रहा है मरीज मेल है फीमेल नहीं इसलिए सब ओके सामान्य तौर पर which is generally तबीयत ठीक नहीं है कि मेरी बूढ़ी शरीर which is body में दर्द हो रहा है मैं इतना कमजोर महसूस करता हूँ कि कुछ भी नहीं कर सकता हूँ कभी चक्कर आते हैं कभी सिर दर्द हो रहा है कभी दिल की धड़कन तेज हो जाते हैं कभी सांस लेने में तकलीफ हो रहा है और अक्सर नींद आती है लेकिन सो नहीं पाता डॉक्टर कब से ये समस्या हो रही है कई महीनों से लेकिन आता जाता है अच्छा मुझे आपके जांच करने की अनुमति दीजिए which let me check you और एग्जामिन यू अच्छा एग्जामिन के बाद सबसे परीक्षण करवाकर वापस आए कुछ दिनों के बाद नमस्ते डॉक्टर ये मेरा परीक्षण ये रहा मेरा परीक्षण जैसे डॉक्टर सेड जैसे कि मैंने अनुमान लगाया आपके शरीर में कोई बीमारी नहीं मैं आपको दवा नहीं लिखूंगा लेकिन सलाह दूंगा स्वास्थ्य के लिए अच्छा खाना खाए काफी पानी पिए रात को 8 घंटे को नींद ले और आधा घंटा पैदल चले और दिल की तसल्ली के लिए दोस्त बनाए खुश रहे चिंता मत करे दिल से हंसते रहे झगड़ा मत करे जिए और जीने दे
Very good. Awesome. Great. You know some of the advanced stuff. And then, so I'm going to take again back to the grammar portion. So that way, at least, you can really see what other people were saying and as they were, seeking their phrases. Okay. So the one way we learned about it, which a lot of you use, which is mere पैर में दर्द है, or mere नाक में दर्द है. Generally, pain is considered, an experience in Hindi. It's not like an active verb. It's something that is coming to you. Okay. So if you guys recall, it's something that is coming to you. And then something that is coming to you, if you're a recipient of something, you will not use I. You will say I and then to me, basically. Right. And to me in Hindi is mujhe. Okay. So imagine you have a pain or the different symptoms that are showing or to you or coming to you, you would say it's happening to me. Okay, give me just 1 minute so I can just So you will say it's something happening to me. So if I want to say the pain is happening to me, मुझे दर्द हो रहा है. Okay, so I'm going to take a small. When in the previous scenarios, you are talking about where the pain is located. If it is actively happening, you will say dard hona. And if it is actively happening, you will use a thing called present continuous tense. Present continuous tense to show that it is happening right now. And as you know, for present continuous, you take the verb, in this case, dard hona, you remove the na, and you put raha hai, rahi hai, or rahe hain, based on the subject. Okay, and now you will say dard ho raha hai. Okay, for dard you will say raha hai, dard by default, dard ho raha hai. Okay, if this thing changes, you will use it, a different one. Okay, so if it is instead of dard, if it is khasi, cough, as one of you mentioned, you will say khasi ho rahi hai. Khasi is cough, khasi ho rahi hai. So everything that I wrote on the top is masculine, everything at the bottom is feminine. Okay, so I'm going to practice with you guys so you guys get a chance to do that. Okay, so Jonas, I want you to unmute and practice speaking this sort of, the pattern is right in front of you.
Everything, Ashuji?
Just one or two.
Just one. We start with one. मुझे दर्द हो रहा है.
Beautiful. मुझे दर्द हो रहा है. Simple one. Good job. Fernanda ji.
मुझे खांसी हो रही है.
Beautiful. Kavita ji.
मुझे घबराहट हो रहा है.
Okay. Ghabrahat is?
Ghabrahat and anxiety. New one. Anxiety.
Yeah. So the feminine. So it would be?
Oh, it's feminine. Ho rahi.
Yeah. Beautiful. मुझे घबराहट हो रही है. Beautiful. Okay. Maya ji.
मुझे थकान हो रहा है.
Thakan is also feminine, so it would be?
मुझे थकान हो रही है.
Beautiful. मुझे थकान हो रही है. Wonderful. Fiona ji?
मुझे खुजली हो रही है.
Okay. Meeta ji?
Jalan, मुझे, is that me or her? Sorry.
Yeah, you, Meeta ji.
मुझे जलन हो रही है.
Beautiful. Okay. मुझे जलन हो रही है. Some of the words are just adopted in Hindi, and you can very well use them, and it's commonly known, like tension is commonly used as a tension, as if like it was always a Hindi word, right? So like this is like a tension is like, even if you go to the rural part of India also, they will say tension ho rahi hai. Like, so it's some of the words are just adopted as it is, right? So similarly, irritation and acidity, irritation not so much, but acidity is also a very commonly used one, right? So feel free to use them as well as just directly in English. Katie ji?
मुझे जुकाम हो रहा है.
Beautiful. Michael ji from Pennsylvania.
मुझे infection हो रहा है.
Very good. Okay. Austin ji, let's say you're talking about something different. Swelling.
मुझे सुझाव हो रहा है.
Okay, so the word here, okay. Sujan. मुझे सूजन हो रही है. Okay. And you can locate it like मुझे यहाँ सूजन हो रही है. Okay, beautiful. Anyone else would like to try? Didn't get a chance. Yeah, go for it.
Okay. हाँ मुझे let's see it is correct. मुझे खाने के बाद हमेशा जलन हो रही है.
Yeah, खाने के बाद जलन हो रही है. Very good, right? Awesome. Sunny ji? Okay.
Do you want me to make a simple sentence? Just
Yes,
say,
simple sentence, yes.
okay. मेरा सारे त्वचा में खुजली हो रहा है.
So खुजली is feminine, so it would be
हो रही है. खुजली हो रही है.
beautiful. Now, the experience you're talking about, you can see that you use the verb called hona. You don't have to have hona all the time. Sometimes it is the feeling, okay, perception, right? So which you use, it's coming to you right now, but you know, it's instead of happening, you're feeling it, right? So you will use a different word in Hindi for that, okay? So Fiona ji, I'm going to ask you to make, because I didn't get a chance to talk to you, make 2 or 3 with this template. One minute. Yes. Unmute yourself, Fiona ji.
मुझे अफसोस है मुझे अच्छा लग रहा है मुझे ठंड लग रही है मुझे प्यास लग रही है
Very good. Very good. Okay. Maya ji, you want to try a few more? Hopefully it's simple, right? Straight, you can follow the template.
मैं बीमारी हूँ मुझे कभी कभी घर में लग रहा है और कभी कभी ठंड लग रहा है
Yeah. So dar is masculine, thand is feminine.
Okay.
Right? So yeah. So it's very good. Like, you know, you can say I am sick. I am sick, you will use the pattern मैं हूँ. Okay? So let's say you're coming to the doctor again and then say the I am sick. मैं
बीमारी हूँ.
No, मैं bird is बीमार.
मैं बीमार हूँ.
Yeah. And doctor will say, doctor will say, अच्छा क्या हो रहा है? What is happening?
मुझे कभी कभी ठंड लग रही है.
Beautiful.
और कभी कभी गर्मी लग रहा है.
गर्मी is also feminine, so it would be कभी कभी गर्मी
लग रही है.
Beautiful. Very good. Great job. Right? Awesome. Katie ji, we'll take some more.
मुझे प्यास लग रही है. मुझे डर लग रहा है.
Okay, awesome. I'm going to have Michael ji from Germany try to use some adverbs with that. So, you know, that way at least, you know, the same thing, like probably when, how often are you feeling it and under what circumstances, right? So as you already heard the word like kabhi kabhi or aksar, what other, you know, adverbs you can use?
मुझे खाते हुए और खाते हुए दर्द में बुरा लग रहा है.
Very good. What is khate hue means?
Like during or while eating.
While eating, very good, right? So you use an advanced one, which is great. I was, you know, I would be okay with simple also, but great, right? So what he did was, if you go to Usha Jain's in the first 2 chapters, you know, she talks about while something is happening, like so while walking, chalte hue, okay, chalte hue mere पैरों में दर्द हो रहा है, okay, and that's a great one actually, right? I mean, while something is happening, you know, you are experiencing this, right? So that experience is coming to you. Great one, okay. While I have you, 3 things. The first one is happening. Second one is to feel. Third one is it's appearing to you to come. Okay. Why don't you continue only?
So मुझे गुस्सा आ रहा है.
Very good. What does it mean?
I am getting angry. Or
Yeah, I'm
anger is
getting.
coming to me.
Yeah, so it's very funny because in English you'll say I'm getting angry, but in Hindi it's coming to you. As an experiencer, you are feeling it. So anger is coming to me. मुझे गुस्सा आ रहा है. Okay, say one more.
मुझे नींद आ रहा है.
Yeah, मुझे नींद आ feminine, right? So it would be.
Oh, नींद आ रही है.
Yeah. So if you want to describe to a doctor that it's not coming to you, the sleep is not coming to you, it would be.
मुझे नींद नहीं आ
Yeah.
रही.
Yeah, right. मुझे नींद नहीं आ रही है. Because that's like a common thing, like, अच्छा, नींद नहीं आ रही, क्यों नहीं आ रही है, right? And you want to say nowadays I'm not getting enough sleep.
आजकल मैं काफी नींद नहीं आती है.
Yeah, very good. Nowadays, sleep is not coming. I'm not able to sleep properly. Would be आजकल मुझे नींद नहीं आ रही है. Yeah, wonderful, awesome. Kavita ji, you want to give it a try? Something that is coming to you here in this case.
मुझे चक्कर आ रही है.
Okay. So chapter is an interesting one, even though I
Yeah.
put it here. It's plural,
Oh,
masculine plural. So it would be
मुझे
raha, rahi.
चक्कर आ रहे हैं.
Beautiful, beautiful.
आ रहे हैं.
Uh-huh. Chakkar is
Dizziness, vertigo.
dizziness. Very good.
Chakkar also is circle or no?
Chakkar is also circle. That is correct. But like when your head is spinning, it's
Yeah.
really, it's like you're trying to describe that to a doctor. That I'm getting the same feeling when your head is spinning, basically vertigo. Yeah. Awesome. Meeta ji again.
Any one of these?
Any one of these. Or you can use anything else also which you have used for Ana.
Mujhe taka. Is that the right one? Mujhe taka aa rahi hai?
थकान आ रही है. Yeah, you can say that. मुझे थकान आ रही है. Yeah. The tiredness is coming to me. Okay, great job. Marwa ji?
मुझे रोना आ रहे हैं.
Okay, very good. रोना आ रहा है. Awesome. Sharon ji? For some reason, I didn't see you.
You didn't see me. I came
Yeah,
I came in a little bit late today.
It's okay. Go for it.
मैं चलता हुए चक्कर आ रहे हैं.
Very good, right? मुझे चलते हुए चक्कर आ रहे हैं. Awesome. You want to make a few more?
I had one before. मैं थका हुआ और मैं थकान रही है क्योंकि मैं ठीक से नहीं सोया.
Very good. Right? मुझे थकान आ रही है क्योंकि मैं ठीक से नहीं सोई. Okay, awesome.
Okay.
Yeah, we'll take one more. Leena ji?
मुझे नींद आ रही है.
Okay, मुझे नींद आ रही है. Okay, for negative, you can just say मुझे नींद नहीं आ रही है. Yeah, awesome. Right? So if you notice it, for some of you, the mujhe part may be new. And just to kind of do a quick recap, in English, things are generally, there's a difference in Hindi when it comes to doing versus happening. When you say I open the window, you're using I versus I feel pain and I have pain. In English, it's always I. So it's almost give you the illusion that I'm the doer of the pain. Just like I'm opening the window, I'm the doer of it. For the pain also, it gives the illusion that I'm the doer, but you're not causing the pain. It's coming to you in Hindi, right? So in Hindi, it's anybody who's receiving something should be marked with the postposition ko. So what you would do is you would take the I or the base pronoun, and you will mark it with ko. Right? So it will become muj, मैं becomes मुझे or मुझको, हम becomes हमको, आप becomes आपको, तुम becomes तुमको, and similarly you will say तुझे, तुझको, इसे, इसको, उसे, उसको, similarly उनको, इनको, and उनको. So that's a thing that you just saw the use of mujhe. Okay, but if you are taking someone with you to the doctor, okay, and you can say इसको चक्कर आ रहे हैं, okay, और मेरे बेटे को चक्कर आ रहे हैं, और मेरी बेटी को चक्कर आ रहे हैं. Yeah, so hopefully that kind of clarifies the use of ko here. And before I kind of go to the phrases, I know we are short on time, so I have to rush it a little bit, but I do want to go over some other commonly used phrases, and which may not necessarily fit into the template that we have, but I think you should all know these. And you will hear them often as you read the articles, or, any of this context is coming. So I'm going to have some of you read it out. So Mita Weiss from LA, you want to read the first two?
मुझे acidity हो रही है.
What does it mean?
I have acidity. It's like it's happening right now. मैं सुबह से खांस रहा हूँ. This morning, I don't know what खांस is.
Khasi is cough. And khasna, khasi is cough, and to cough is khasna. And then in this case,
So this morning I have a cough, or cough is happening.
It's subah se is since this
morning. Oh, since the morning.
Okay. Yeah. Subah se.
Thank you.
So in some of the cases, people were asking like kab se, since when? 2 दिन से, मुझे 2 दिन से बुखार है, और मुझे 3 दिन से चक्कर आ रहे हैं. Right? So because this is a common thing, the doctor will ask, like, since when have you started experiencing this one, right? So Fiona ji, read a few of these and the meaning of it.
मैं ठीक से सो नहीं पा रहा हूँ. Difficult one. मैं ठीक से सो नहीं पा रहा हूँ. Not sure. Something about
take a guess.
Not being able to sleep, isn't it, or something? So nahi pa raha ho. मैं ठीक से I don't know. I haven't been able to sleep for a while, is it? Or I'm not sure. मैं ठीक से says from.
ठीक से. So in this case, it's not from. ठीक से. ठीक से is together. मुझे ठीक से. Properly. It's an adverb called properly.
Okay. I haven't been able to sleep properly.
That's right. I've not been able to sleep properly. ठीक से. Okay. Very good. Next one also.
मेरा गला बैठ गया हो. I've got a problem here too. I say gala is throat. Like my throat. बैठ गया हो is has been sitting or something. It's obviously an idiom, but I don't know what it is.
That's the whole part of it, because people will say this way, gala baithna, right? Because it's a term, gala baithna, but doesn't mean you will not literally. It's going back to the principle we learned in the beginning of the class. Who would like to guess what is gala baithna? Sunny ji, you are a doctor. What do you think gala baithna? What does gala baithna mean? Sunny ji is like, I don't know. I would unmute yourself.
No. Sorry. It means gala baithna means either stuck or sore.
Sore. Okay. Anyone else? Okay. While I have used, go ahead, Meeta ji. Go for it.
Does it mean closed up? Like it's kind of
Closed
constricted?
Okay. Gala baithna. Anyone else?
would say sore throat.
It's like sore.
So,
Yeah.
okay,
Hoarse.
okay, wonderful. Okay, yeah, okay. I'll show you the answer soon. But yeah, and then let's do Austin ji. Why don't you do the next two?
Next two.
This one and this one.
मुझे सांस लेने में तकलीफ है. So it's difficult to breathe.
Yeah, and you can make it continuous also, and that would become
मुझे सांस लेने में तकलीफ हो रही है.
beautiful. And what does it
And
mean?
then right now it's difficult to breathe. I'm having
Yeah,
difficulty breathing.
I'm having difficulty breathing. Amazing. Okay, next one.
मुझे 2 दिन से बुखार हो रहा है. I've had fever for the last 2 days.
Okay, great.
Or it's been fever. It's still fevering now.
Yes. Okay. JVG, last one is the harder one.
मेरा साहिर टूट रहा है. God, what is sahir? I have no idea what that is.
Sharir is body.
Oh, my body's broken?
Yeah, so what do you think it means?
I don't know. My body, well, no, I don't know. Isn't tooth broken? I thought it was broken.
It's okay. It's okay. It's almost there. Okay, so it's too nice to break. Right?
So my body's breaking?
Yeah. What do you think it implies?
You're tired. You're worn out.
Yeah. Okay. Or anyone else? Anyone else heard of?
Like full body ache.
Full body.
Yes, in जुकाम
Body
शरीर
fatigue.
टूट रही है.
Huh?
Yes, in जुकाम शरीर टूट रहा है.
Yeah.
बिल्कुल सही है.
Yeah. So one thing is like, and again, I don't know whether it is but this is it's been like more than 2 decades here, right? Here in the US, like the doctor, I mean, again, things are changing, so some of may be outdated, but the doctor will just keep going further and further till they get granular about where the issue is. And so the patients are also used to giving very precise thing about where the pain is happening or where the issue is. But back in India, it was generic, right? So it's like the whole body, fix it, basically, fix the whole thing. So that's where like some of the like sharir toot raha hai, the whole body is hurting, basically, like fix it, right? So here it is, like my whole body is aching all over it. So literally, like body is breaking. Like so, if you have pain all over your body, which it should not, but yeah, And similarly, I have lost my voice. My, throat is, choked up basically, right? मेरा गला बैठा हुआ है. Like, when people are talking and then, you cannot hear them. Like, that's when there is, you say that, the gala बैठ गया है. It's extreme cold and you end up, I don't know how to describe it, but I've not seen it here much, but like it used to be very common. So gala बैठ गया है. I've lost my voice basically. Any questions, anyone on any of this? But these are common. You should know all these phrases.
No question.
Yeah, go for it, Kavita.
Oh, sorry. Okay.
Pa raha hu. What verb is pa?
Yeah,
मैं
yeah,
ठीक से सो नहीं पा रहा हूँ.
yeah. So it's who would like to tell which verb is this?
Parna, to manage, to do
Parna.
something.
Oh, I didn't
Yeah, so we'll do that
Thank
then. Pana, yeah. Chal pana, dekh pana, soch pana, right? So it's fun.
Thank
Okay.
you.
Wonderful. I know we are slightly over time. So some of you may have to leave. So I want to cover the scenarios for the people who couldn't do it. But if somebody have commitment, I want to at least show you what we will be covering next week. So that way at least you will not miss it. So next week, you will talk about your summer plans or any upcoming thing that you want to do. So there will be use of future indefinite. I will share some small clipping, but pretty soon we'll be in a situation where we may not have covered the scenarios. So I will just expect you to just try your best to come up with, and I'll give you a hint of it, but at least you would have covered some of the basic stuff, right? As you come to the class, right? So again, talk about your summer plans or any new plans you have, uh, and we'll learn about future indefinite. Okay. So going back, I'm gonna stop sharing and we'll do scenarios. I know Sunnyji prepared something, so go for it, Sunnyji.
Okay. I had actually prepared a scenario since I'm a doctor, and I frequently have to talk to Hindi patients. They're usually relatives of immigrants. So to develop a bond with them, I try to make contact. And the most common problem I see in the clinic is back pain, and they need surgery. So I'll just go through a quick scenario. They usually call you Doc Saab, and the meeting is called Mulakat. The doctor say Mulakat hai. And then I usually start by asking them, they say, "Mein peet mein dard ho raha hai." And now, as a doctor, I have to get some more information. So I say, "Kitna samay se? How long have you had this pain?" And they say, "Well, 5 months, 6 months." So I ask them, "The pain is continuous, लगातार हो रहा है?" And they say, "Okay." And I say, I have to ask them, "How severe is it?" So we use a pain scale. I say, 1 से 10 से आपका कितना भीषण है? So how severe is it? And they say 10. Usually they say 10 out of 10. And then I have to ask them to describe the pain. कुछ और बता सकते हैं पेन के बारे में? पेन जलने हैं? Is there burning pain? चुभने हैं? Means stabbing pain? Or aintin वाला है? So cramping pain? And then they say, they give me a description. And then I say, okay, ये दर्द कहाँ जाता है? Where does it go? And then they say, well, I asked a specific question because they say, पैर पर जाता है या क्या? You say, yes, it goes to my leg. And then I have to ask them, is there numbness and tingling? इसके साथ सुनता है और झंझनाहट होता है? That means pain or tingling, I mean, numbness or tingling होता है? And they say, yeah. And then I say, क्या और लक्षण है? What other symptoms do you have? And they say, well, they talk about their symptoms. Then I say, क्या आप क्या दवा क्या खा चुके हैं? What medicine have you taken? And they say, wait, this medicine and that medicine. And then they usually ask, और कुछ तेज दवा मिल सकते हैं? Can you give me a stronger medicine? I usually tell them, okay, आप मोटरन खा चुकी है, लेकिन मैं कोडीन दे सकता हूँ. So I'll give you codeine. And lekin, so I'm going to tell them there could be some side effects. ये क्या side effects? I'll say उल्टी लगना होता है और पेट खराब. You could have pain. Your abdomen could have go wrong. और dust हो सकता है. और कभी-कभी liver, collate. Your liver can be affected. It be प्रभावित करता है और कभी-कभी चक्कर भी हो
आ
सकता
सकते
है.
हैं.
Okay, then they ask what kind of treatment, क्या इलाज? So I'll say, what are my options? विकल्प क्या है? So I usually tell them, पहले टेस्ट करना पड़ेगा. What kind of test? I say blood test. So the word for blood test is खून की जांच करना पड़ेगी और MRI करना पड़ेगी. And then I asked them about their past history because I want to talk about surgery. I asked, and a lot of the patients, the older patients, they say, I've had a heart attack or दिल के दौरा होता है, in the past tense. And I tell them, they ask me, what does it mean? ये क्या मतलब है? I say your test shows that you have pressure on your nerves. नसों पर दबाव, there's pressure on your nerve. And then I go on and say, आपको surgery शुरू करना चाहिए. And they say, I say, they are usually reluctant to have surgery. Sometimes they say, can I get a second opinion? I say, बिल्कुल आपको दूसरे राय भी, I don't know how to say, you can get a second opinion or whatever. Then they say, I tell them, if you have to have surgery soon, because you could get paralyzed, to prevent paralysis. आपको जल्दी ही सर्जरी करना जरूरत है क्योंकि लकवा से बचाने के लिए. And so that's more or less my conversation. And
Very
then they ask about the side effects of the hospital. But the most important thing they want to know is, what are the chances of success? The word for success is safalta. So, and I usually answer, सफलता का thing, I don't know how to say it quickly, more than 90%, 90% के अधिक है.
That's good, right? More than 90%. Yeah. Great job. I think what you दूसरी राय लेनी चाहिए, right? This is anybody can use it. क्या मुझे दूसरी राय लेनी चाहिए? Should I take another opinion? दूसरी राय is opinion, and राय because it's feminine, it's दूसरा become दूसरी. Second opinion, दूसरी राय लेनी चाहिए. Should I take a second opinion? Right? So anyone else? I know we are slightly over time, but I want to be respectful if people prepared, and I don't want you to feel that you couldn't even go over your paragraph or write up.
I can
Go for it.
I can read a small thing.
Yes, go for it.
मैं कल मेरे डॉक्टर गई क्योंकि मैं बीमार हूँ. मेरी डॉक्टर का नाम डॉक्टर नीना कुमार है. कल मेरा अपॉइंटमेंट सुबह 10 बजे था. मैं 1 महीने से मेरा सिर में दर्द है. डॉक्टर कुमार ने मुझको कई सवाल पूछी. क्या आप सोती हैं? क्या आप अच्छा खाना खाती हैं? क्या आप बहुत पानी पीती हैं? मैंने उसको बताया कि मैं अब बहुत काम कर रही हूँ. कुछ दिन में खाना नहीं खाती हूँ और मैं पानी नहीं पीती हूँ. डॉक्टर कुमार ने मुझको बताया, दवा नहीं लीजिए, आराम कीजिए.
Beautiful. Great job there. Okay. You spoke very nicely and slowly, so great job there. Okay. Anyway, just to recap, I hope everyone found it useful. There are different ways people describe, but again, just to recap, from grammar perspective, we learned about ko, that something that is coming to you, use the postposition ko with the pronoun, right? So that's what you need to remember. The second one is the present continuous tense. If the pain is happening actively, you will use the hona, ana, and lagna, right? So at a minimum, remember to use these common phrases like मुझे जुकाम हो रहा है, मुझे खांसी हो रही है. Similarly, मुझे डर लग रहा है या मुझे ठंड लग रही है. And similarly, मुझे गुस्सा आ रहा है और मुझे पसीना नहीं आ रहा है. Sometimes when you're not getting any sweat, you also want to describe it as a symptom. मुझे बिल्कुल पसीना नहीं आ रहा है और बहुत ज्यादा पसीना is a sweat, right? If you're sweating a lot, that's also an indication to tell the doctor that मुझे बहुत पसीना आ रहा है. Okay, और मुझे चक्कर आ रहे हैं. So right, at a minimum, if you remember a combination of it, you've done a reasonable job of at least explaining it, at least your symptom to the doctor. And of course, like the adverbs around like when is it happening or since how long it's been happening, all of those are sort of part of the conversation. So for folks who watch live on Facebook, thank you so much. I'm going to stop the recording